We have Professor Dr. Patrice Francois Boussier. I hope I've done justice to your name, Prof. Let me just introduce our esteemed speaker here to everyone. Professor Patrice Francois Boussier has earned his bachelor in computer and PhD in computer science from University Pierre and Marie Curie, France in 1981. He received the national accreditation for full professorship from the French Ministry of Higher Education and Paris South University in 1996. And he has been appointed professor in computer science at International Medical University in February 2020, in charge of developing new and undergraduate and postgraduate programs related to digital health and health analytics. Prior to this, he has been head of the school computing at Taylor's University between 2018 to 2019, and Dean of the STEM faculty at International University of Malaya, Wales from 2014 to 2017. Very illustrious. Welcome, Prof.
Thank you very much.
And moving on to our next esteemed speaker, we have Dr. Raymond Choi, very interesting background as well. Dr. Raymond Choi is a medical practitioner specializing in family and aviation medicine. Now, Dr. Raymond, I've actually looked up what is the meaning of aviation medicine. Very, very interesting. Very niche, I must say as well, yeah? And Dr. Choi started his foray into the field of medicine at International Medical University, Malaysia in 2013, and he graduated from the University of Manchester, UK with a Bachelor of Medicine and, and Bachelor of Surgery. Aside from his management and physician duties in the role, Dr. Choi was also tasked with engaging with stakeholders within the airport, like the Ministry of Health, the National Environment Agency, Changi Airport Group, and other ground handling agencies to ensure smooth operations in terms of health and safety of airport community, including aviation safety. Passionate about public health care, Dr. Choi later co-founded Doc2Us with his partner Jack in December 2014 and incorporated the company under the name Hey Doc International Seram Bahat in April 2015 in Kuala Lumpur, Malaysia. Welcome aboard, Dr. Raymond. It's great to see you today.
Thank you, Hani.
And last but not least, we have Mr. Hazwan. Mr. Hazwan, who is a co-founder of Doctor On Call. So the name is might be familiar to most of us. Yeah, Mr. Hazwan Ajib is the co-founder of Doctor On Call Malaysia. He started Doctor On Call more than 3 years ago with his partner and former colleague, Marin Virumandi. After spending months studying the trend and growth of telehealth industry globally, he and his partner decided to establish Doctor On Call, the leading digital health platform for patients to speak to a qualified doctor through chat, audio, or video channel. Since then, this platform has grown from strength to strength and now provides health information to more than 2 million users on a monthly basis and thousands of individuals who are looking for personalized medical advice from qualified doctors. Very, very interesting. Welcome on board, Mr. Hazwan. It's great to meet all of you today. I've got a gazillion questions for all of you three, and we would like to kick off the afternoon today by inviting Professor Patrice to perhaps share some of his thoughts in the topic of transformation of digital health. Perhaps you may want to share with us, something about analytics and digital technologies, and how does it work into the traditional programs from your perspective. Would you like to share some thoughts about this, sir?
Okay, thank you very much, Anne. In fact, what we call data analytics is not very new. It started many years ago, in fact, with some data analytics based on statistics, in fact. And more recently, in the year 2000 and 2010, it became more popular because of the development of what we call now data science, and the possibility to do much more, having a lot more data available, and what we call big data, and some more powerful computers and artificial intelligence at the same time, with what you call machine learning and deep learning. And so it was, at the beginning, it was very popular for business analytics, in fact, retail also. And now we see it developing very fast in healthcare. And so we have health analytics. And altogether, we call this impact of the new technologies, IT, AI, all these things, we call it either digital health or health informatics and analytics. So it depends who's talking, in which country, but digital health maybe is a little more towards healthcare. When we say health informatics, maybe it's a little more people who are into IT, computer science, AI. But it's not very different. Huh? It's we are talking about using AI, IT, computing, computer science into healthcare, and to develop some new applications and new facilities. And so at the moment, digital health is a hot topic, and including with governments, universities, companies all over the world. And this happened because mostly at the moment because of the pandemic. It was already there before, but this pandemic has accelerated the growth of digital health. And unfortunately, we are expecting more diseases, new pandemics in the future, and we have to be sure that we have the tools to defend ourselves, new vaccines and this kind of thing. So that's why it's very important to invest into digital health and health informatics and analytics. And it's very important in telemetry. We see that telemetry has been very popular during the last 2 years because people, it was very difficult for people to go to hospitals, so it was much easier to consult from their home remotely. And but Raymond and Yawan will explain to us. And we also have we had a great impact of digital health, what we can call digital health in general, with drug discovery, because the messenger RNA vaccines have been discovered very fast because they were using artificial intelligence. It was much easier, much faster, not easier but faster, to try new molecules and see if there were some potential candidates. We also have something that is very important, but we don't talk so much at the moment because we talk about the pandemic. But CRISPR techniques are becoming very important, and it's also some kind of digital health. It's also involving health and informatics at the same time, and artificial intelligence.
Can you explain a little bit more about that, sir?
About?
The topic that you've the subject that you've just mentioned, something that we don't really talk about it, but why is this important that we need to discuss it in the current environment now?
Yeah, it's important because we will need more specialists in the future, specialists who know healthcare, but who know also the technology. In fact, when we are talking with some companies in UK and Malaysia, and they say that, in fact, it's difficult at the moment to recruit people who are good in both, who have a background in either one of these, but who know both of them. So they need to have a background in healthcare or informatics and complement with the other subject. So that's why we have created in IMU 2 programs. I was recruited for this. So we have the master in health informatics and analytics that we started in September last year. And we will start the bachelor in digital health in September 2022. And in our master program, we for the first intake, we had 15 candidates, 15 students, in fact, who enrolled. And 6 of them were medical doctors, medical officers.
Wow.
And 2 others from medical bioinformatics, health sciences, this kind of thing, and 2 from IT business startups. So it shows that there is a big interest in the medical profession for such programs, because I believe, in fact, I've worked with medical doctors a long time ago in France, but I'm quite very much convinced that yeah, that medical professions need to know more about the technology, about
Right.
AI, about a bit about computing. Even if they don't become specialists, they need to know, because they will have to work with the specialists. They will have to work with computer scientists, software developers, and then they have to know what they can do and to be able to work with them.
Yes, yes, it just makes sense. It just makes sense. Now, based from what you've just shared with all of us, I do have quite a number of lists that I would love to ask you. I'll just park that for now, simply because I would like to hear something from from Dr. Raymond on a very specific topic, which is transforming the health services to digital health. I think this is pretty much important topic to discuss as well, because we know how important it is in terms of the health services. It needs to be transformed, especially with the current situation that we're facing right now. So perhaps, Dr. Raymond, would you like to share some thoughts on this topic?
Sorry, Hani, Hazwan here. Is there a swap in topic, or is it?
Sorry, go ahead.
Honey, yeah, is there a swap in topic? Is it this topic
supposed to be mine, and
yeah. So sorry.
I'm happy to answer, but
correct.
It's just I'm so ready to talk about health services.
Yes, because I'm just so eager to to address that. Is just a quick shift. Thanks so much, Mr. Hazwan. Actually, it's you that I really wanted to talk to about this, the transformation of health services. And I think this is, as I mentioned, this is a very important topic. And you know, we're facing with the pandemic, and we've been doing this for the past 2 years. And you know, I actually read a lot about Dr. On Call. And so therefore, I do have quite a number of things I would like to ask from you, but perhaps you want to kind of introduce what is Dr. On Call and how is this impacting the transforming the health services to digital health for now.
Okay, thanks, Hani. I would like to just share a couple of slides to accompany my perspective. Actually, we started Dr. On Call back in 2017, so it's been 5 years, right? I didn't realize it's 2022. I think similar to Dr. Raymond with Doctors, we started at the same time. We did a lot of research, right? So there was a boom in the telehealth startup, telehealth providers, so where they provide basically just the most basic thing about connecting patients to doctors, right? So right now, when you talk about health services or healthcare, right, people just think, okay, I'm going to the clinic or I'm talking to a doctor. So those are typically the entry point where a lot of people, a lot of companies looking at how to make it easier for patients to connect with doctors, right? If you think about it, just like banking, how you move from going to the branch to phone banking to ATM and then to mobile banking and then now to whatever banking, right? So that industry has started transforming back in early 2000. Unfortunately for healthcare, we are quite behind, right? In terms of technology adoption. I think there is, I think the more we learn from it, we know why, right? Because there's a lot of conservatism in healthcare. There's a lot of risk to take as well, right? You know, the lawmakers would be thinking what is the impact, when it comes to adopting technology. Right. So we started with online doctor consultation, e-pharmacy, medication delivery, and soon after, we slowly look at other health care services, right? Our core services include the corporate corporate and insurance subscriptions, the booking services, and then now we have a lot more on the preventative and labs and diagnostics side of things, right? If you think about it, for health services, okay, just a little bit more, Dr. On-Call, our aim is to really to be the healthcare super app, right? You know, we want to attract health seekers globally. We want to generate healthcare demand through a lot of things, right? So we have AI tools, a lot of gamification in healthcare. You know, people play, do their assessments on whatever conditions they have, snap a photo of the skin or skin condition, and then try to see, like, you know, what are potentially these rashes that you have and things like that, right? But at the same time, we also don't want to stop there, right? So once they have all these tools that they gamify and do the self-diagnostic, self-assessments, we want to connect them to doctors and proper qualified healthcare professionals, be it doctors, nurses, allied health professionals, and so on, right? And eventually, we also close the service with all sorts of things that they need, medical devices, medicines, and so on. So this is just a journey that we have developed over the last 5 years. It has evolved, right? Some people want this, some people, if you ask a lot of, if you ask people, it depends who do you ask, right? Some people say it's pharmacy is the way to go. Some people say it's, you know, like, you know, just medical tourism is the way to go, right? But at the end of the day, like, you know, healthcare services boils down to how do we make all these things, like, you know, faster, better, and cheaper. Depends on what segment you're targeting, right? Because people who just need to talk to doctor or to get medication for cough and cold is different from people who are searching for thousands of specialists to cure cancer. Yeah, so it depends on where we are at in the healthcare journey as well. Right. Yeah, so since you mentioned healthcare services, right? There's so many things that, you know, comes under healthcare services, and this is not even the main list, right? When we started with telemedicine, just basically mimicking the, basically you know, allowing the patient to speak to doctors, but there are other things, right? That doesn't, you're talking about preventative care, mental health, physical, occupational therapy, care compliance is also an area that that's quite interesting. I'll share with you a quick case study what I saw in this space. And then you have a rehab care, even prenatal care, right? You have those mobile CTG that are seen being used in certain countries. Okay. So one thing I would like to share is that, you know, if you think about healthcare services, right? Why do you get into it, right? What's the point of moving it to digital, right? Think about it. As long as you move it because it is either better, either cheaper, or either faster, right? There is a case to move it, right? You don't just suka-suka to move things to digital because, right? Better covers everything, right? Better covers patient safety, better covers, you know, better clinical outcome, and so on. Right? If you think about, okay, I don't know whether you are familiar, I'm sure some of you have seen this, right? This is a game created by someone for the children with cancer, right? What they notice is during the cancer treatment, that many children have to be in the hospital for months, right? And many of them can't take the pressure and the stress of going through chemotherapy and so on, right? So they created this therapeutic game to help them deal with that whole post-cancer treatment, right? So they play this, and I think there's whole research around it, and it gives them better compliance to treatment for the children. You can read all about it. So this is what I mean is like, this one was more like, you know, like no one really think of this like 5 years ago,
Yeah.
right? But now we need to think of what makes it better for the children with cancer. So just to summarize, there are a lot of opportunities. There are a lot of, the way I think the medical industry or the world is shaped now, right? There won't be any same career path or a trajectory that we can expect in the next 10 years, right? You can, for all you know, you can make a living out of just creating, you know, healthcare game content.
Why not?
Right. Yeah.
Yeah, cool.
Yeah. So
no,
in short, faster, cheaper, better.
faster,
Anything
cheaper,
you can
better.
transform into digital health services.
Okay, very interesting. Faster, cheaper, better. Having said this, I think a lot of people who live in the city, you know, the urbanites would be able to identify all of this, you know, because we have the ability to be connected online and all that. I'm very sure that you've seen quite a bit of challenges as well in transforming mindset into accepting, you know, certain healthcare services to digital. For example, sometime last year, I had a medical crisis, and because of the lockdown, I wasn't able to go out, you know, meet my physician who is far away in Klang, of all places, you know, because she's far away from me. So what we did was we created conversations and, you know, first line of defense, so-called, using Zoom and uploading certain images, you know, taking pictures and all that, and using all of those to kind of having a conversation around the medical crisis that I have. So I thought that was really, really cool, without realizing that we have actually expanded the scope of digital health into something so lovely as this. So based from your experience for the past number of years in this particular, you know, domain, what have been the, I don't know, top 2, top 3 challenges you think that would be you know, a derailer or kind of challenge for people to take up positively and, you know, get on board with this? What do you think?
Okay, I think it boils down to really 2 main things. Number one is with healthcare, people want the regulatory or government or lawmakers endorsement, right? You can't, I mean, even though there are so many people go out there for all the miracle pills and whatnot, right? But I think when it comes to legitimate healthcare services, they want that endorsement. But that endorsement, I'm not just talking about Malaysia, but just globally, right? The adoption to digital health is new to everyone, right? I mean, even some of the countries like Japan and all are quite behind compared to us. You know, even just came back from the Middle East. You know, their range of services in digital health is not as extensive as ours. That what we have here, right? So it took us years to because that it is a gray areas. There's no clear path to whether is this digital health have a clinic license or what license, that license, right, and all that, right? Yes. So, but I think, you know, in Malaysia at least, that, you know, the ministry is working towards legitimizing it with certain framework, right? That's good. Of course, thank you to pandemic to expedite this whole thing, right? Because I think even though we could have given up halfway because this is taking too long, right? But you know, as long as you build something that is, again, faster, cheaper, better, there's no way it would fail, right? It would work eventually. It just takes time.
Yeah, time is all we need right now, and I think for the past 2 years, that's all we have, time. To be creative. Yeah. Thanks so much. I've got another gazillion questions that I would love to ask of you, but let us now move to Dr. Raymond.
Hello.
Hey, and Dr. Raymond, I did quite a number of readings on, you know, your business model, and I think it's very, very cool. Now, I I discovered something on your website as well, which I think is very, very useful to a lot of women. But I'm going to just reserve that for quite a bit before we get into that particular question. May I please invite you to share with us a little bit about what you do and what is Doc to us?
Yeah, sure. Thanks. You sure this question is for me, right?
Yeah, that's for you. Doc to us.
Yeah, just joking, honey. Yeah, I think thanks for the invitation, and I think more or less I think Haswan and also Prof have shared pretty much on the digital health landscape in Malaysia. So I'll just touch a little bit on what we do. Why Talk to Us? Basically, it sounds like talk to us, right? We want people to talk to us, right? So how did we start this? Actually, because me myself, I'm graduated from IMU, my phase one, and then I went to UK to pursue my studies and and graduate as a medical practitioners. So I'm sure a lot of medical practitioners here will agree with me that a lot of times our family members, friends, and or colleagues, right, will come to us and ask us about medical related questions. And because of that, one day it just got us thinking, well, if those people without such privilege, where do they go to? Like, for instance, honey, right? During this pandemic outbreak, your physician was far away, right? So where did you get the information, right? So because of that, naively, we started the idea, quite similar to Dr. On-Call time, that in 2015, that why do we create a simple platform to connect the two dots, right? Healthcare providers and the patients or the consumers. And because of that, we started this, without any, business mindset or whatsoever. First time building tech company, right? So we went through a lot of challenges, like what Haswan mentioned just now, all the regulatory breaks, all this, right? And so that's how we started, and really provided a platform simply to with a vision to improve health and well-being of all mankind, leveraging on technology, right? So and because of this pandemic outbreak, we were quite privileged and given the opportunity to help to contribute a little bit to the country, and where we integrate with MySejahtera to provide free virtual health advisory since March 2020 until today. So we've done more than 1.7 million hours of free services to the public, answering anything about COVID-19, ranging from what is COVID-19 when we first started, MCO lockdown, how was it transmitted, but should I wear a mask, all the way until quarantine at home, being COVID-19 positive at home, what should we do, a rapid test kit, when do I do that? So all this information we are able to actually rally more than 100 healthcare providers voluntarily, right? We are so blessed, right, this country, right, where people will come forward to provide such services. And this is one of the very simple, low tech, virtual health advisory that we provide to the public. And this is possibly the first, first glimpse or first taste for the people in the public to actually enjoy or experience what is digital healthcare services, right? To talk to the doctors online, right? Even just a general advisory. And also we participate in the vaccination programs with the government. So these are some of the people we work with. And in terms of an ecosystem, or Doc to us, all
Dr. Raymond, sorry to interrupt you. I think we missed your slide. It's dark, so we can't see. How
about now?
Okay, good.
Okay, so maybe let me use this view. Maybe it's my Zoom issue. Yeah. So
okay.
So I was talking about the virtual advisory, and this is some of the PTV that we did. So in terms of ecosystem, yeah. So in terms of ecosystem, in digital health, you and I know that healthcare, we can't do everything digital, right? And likewise, we cannot do everything offline right now. And this pandemic outbreak has proven that, right? So how can we actually merge together? Some people call it OMO, some people call it hybrid care, whatever we call it, is really about bringing more values to the patients, to the providers, right? And of course, maybe to the payer, right? And hence, we have teleconsult services, e-pharmacy solutions, range, and we have the consumer healthcare, which is the offline services. And we have a content, that actually we generate to educate the public on health and, safety and things like that. So these are some of our partnerships and corporate clients that we're serving. And this is an interesting slide that we want to share that, in terms of e-prescription, we launched to the market in 2017, right? Where, the whole year we did about less than 500 e-prescriptions, right? Was very bad, right? And subsequently in 2018, we started venturing into corporate solution, where we actually, started serving, Hong Leong Bank, employees. So Hong Leong Bank was the very first in the country, right, that actually adopted, digital health, right? That
Wow.
all the employees, instead of going to panel clinic, they started, seeing doctors online. That was 2018. And because of that, we saw a lot of refilling of the prescriptions coming to us. So that year we did about 5.5K. And subsequently, because of more pharmacy joining, pharmacy also saw the opportunities, and we worked with some chain pharmacies and more corporate coming in. Subsequent year, it went up to close to 90,000 e-prescription that year. So not too bad, 2019. And that's all these are BC. So BC means that before COVID.
Before COVID.
Before COVID, right? So BC time.
That's
right?
a good one.
So all these are before COVID, right? So 2020, and then we have a sharp raise thanks to more adoptions, right? Coming in, and also COVID-19 that actually accelerated the whole journey. And last year we did more than 330,000 e-prescriptions, so it's quite a blessed journey. And this might touch a little bit on your previous question, right? Adaptation and adoption.
Yep.
And we look at this is from some of the study, right? That asking about consumers, right? What do you expect in the future in terms of digital healthcare services, right? In the next 5 years, right? So you can see, on the future, which is a red bar, right? Majority are quite positive on telemedicine, self-diagnosis, digital healthcare solutions, things like that, and online pharmacy, right? So if you look at during this pandemic outbreak, right, in China alone, right, the adoption of digital health or telemedicine, right, is 900%. I mean, the top player like Ping An Good Doctor is crazy, right? And most of them is 100% over, 800%. In the region of Southeast Asia, we're looking at average about 150% in Indonesia or Singapore in terms of adoption in telemedicine during this pandemic outbreak. I think in Malaysia, maybe Haswan maybe can contribute a little bit. We're looking at probably about 70 to 100%, right? Increase in adoption on telemedicine during this pandemic outbreak. And definitely this pandemic outbreak has served as a catalyst, right, an enabler to speed up the process. Where we are right now, actually, without pandemic outbreak, we probably need another 2 to 3 more years, right? Probably Hassan will agree with me. Yeah. So pandemic is a disaster.
2025.
Right? Yeah.
Wow.
So in 3 years time, right? So it's crazy, right? So without pandemic outbreak, right, it's very difficult. Digital healthcare, and healthcare is the most complex industry, like it or not, and one of the most regulated industry. So hence, sadly, it's a least disrupted industry as of if you compare to other industry like banking or this, right? Look at it, banking, it should be very secure, right? But yet the disruption is crazy. But healthcare is very, very far behind banking industry. So these are some of the Southeast Asia player that in terms of telemedicine adoption. And this is a very interesting slide that in terms of adoption, right? So before COVID-19, you see the adoption is quite all right. You might wondering why after pandemic outbreak, Hong Kong and South Korea still stay there. And this is one of the challenges, like Haswan mentioned, regulation.
Right.
So the regulation forbids them from pursuing digital health in the country. So hence you see before and after COVID-19, they are not moving in terms of digital healthcare space. But you see the rest like Japan, Indonesia, Singapore, Australia, China, they're moving towards higher adoption. So it's a very interesting slide, that actually in terms of adoption of digital health. And this is this is 2018. Some of the players in Malaysia. Of course, Dr. Ngpo is here, Dr. I think in digital healthcare, whatever we do, first rule of thumb, right, do no harm. This is what we learn in school. And no matter how much we want to disrupt or innovate, right, always remember that we do no harm and provide values to the patients, right? And this is what I learned from the medical legal. What is not because Haswan mentioned about gray area. You're right. Digital health is a gray area because there's no enforced law at the moment, right? So this is what I learned from the legal, right? That what is not forbidden is allowed. You follow the book, right? Because a lot of acts, right, are in 40s and 50s. Are they able to govern and enforce for today's and tomorrow's healthcare? Probably not. I think ministry and government, they are aware of that. They're playing a catch-up game at the same time without compromising health and safety and the governance of it. So it's a very, very tough area. But at the same time, they leave a space for innovators like all of us to actually continue to innovate in a more secure environment. So hence the regulatory framework, all this to come in place, right? And we hope that this space, should be regulated right? Because it involves the health and safety of patients. At the moment, everyone is self-regulating with their own guidelines and protocols and policies and things like that.
Yeah.
So this is us, and yep, a bit of wrap up of 2021, what we did. So in a nutshell, that's what we do and who we are. I hope I give a little bit of glimpse of you know, the telemedicine and digital healthcare space. Yeah.
I've got a tough question for you.
Please.
On your website, very, very interesting. On your landing page, there is a button there. It says free contraceptive on your landing page. What's the story behind this? Very interesting.
Yeah, I think that's also very interesting approach that, you know, how did we start this? Also because we work with the pharmaceutical company Bayer. Bayer, you know, realized that, you know, in Malaysia and also some part of Southeast Asia, contraception seems to be a taboo for a lot of women due to various
sensitive.
Yeah, sensitive due to various reasons, could be religion, right? And hence, how can we actually penetrate to the women that to educate them on what is contraception, more on what is family planning, right? Yeah. So hence Bayer collaborated with us to come up with a digital solution whereby, you know, by the click of a button, you are able to actually engage with the online pharmacist, a trained online pharmacist in family planning. And from there, actually, they can work out, you know, what is best for you in terms of contraceptions or family planning. And from there, actually, because of prescription, it's not a prescription drugs, right? All these pills. Yep. So pharmacists actually can dispense, unless it's a complicated one, then they will direct to our online doctors. So they work closely together. So in a way, you're able to directly, you know, engage with the pharmacist online, and one-to-one sessions. You know, you can talk about your personal problems, especially when it comes to all these sensitive, you know, problems. So this is a very good, you know, example of how can digitalization helps to close the gap between, you know, healthcare providers and patients, and hence they can even deliver the pills all the way to the doorstep, so that, you know, you don't have to go to anywhere. So that's how it started, and that's you know, that's one they want to move from Malaysia. Malaysia was the first one in the region for this telepharmacy in family planning from Bayer. So they want to move towards other countries like Thailand and the Philippines.
Dr. Raymond, and I found that very, very inspiring, because I think this is one particular area where the term women empowerment, I find that the word women empowerment, it can be used randomly for a lot of things, but this is definitely, you know, on spot, and it gives the empowerment for women to manage themselves, because, you know, contraceptive and all that, number one, like you said, rightly said, it might be a taboo for due to the fact that it might be, you know, from a religious perspective, values perspective, culture perspective, and at the end of the day, the receiving end would be the women themselves. And I think this is one of the great way to allow them to take charge of themselves physically. And
very well summarized, honey.
Beautiful. And that was the first one. I told myself I need to ask Dr. Raymond on this.
Thank you, honey.
Thanks so much. Now, again,